Welcome to Mindray Demo Center. I would like to introduce to you Mindray Resona 7 ultrasound machine with the unique and revolutionary ZST Plus technology, the zonal sonography technology that gives us a perfectly focused image in every time, every pixel, every frame from skin line to the deepest depth. Resona 7 comes with a lot of external features. 6-way direction articulating arm, a movable touch screen, and adjustable control panel. In 6 directions also, with electronic height adjustment. Resona 7 comes with a single crystal convex probe SC51U. Single crystal gives you a better penetration and a high image resolution. Also, we have this button on the touch screen, SSC, sound speed compensation. It calculates the speed of the sound in a specific tissue and recalibrates the imaging system to optimize both spatial and contrast resolution. I'm going to start with a 2D image of the liver. To start, we can select easily the probe from the touch screen and the required examination preset, also one click from the touch screen. As we can see together, a very homogeneous, well-detailed 2D image of the liver with a clear far-field view. The convex probe and abdominal preset need the focus to be 10 cm. One touch on the screen. It also gives you a lot of tools to get accurate results, as the stability index, and we also have the reliability map and reliability index. We have also elasticity tool like shell analysis that gives us accurate result for sound touch elastography. It's a kidney 2D image. As you can see, the differentiation between the echogenicity of the liver and the kidney. First, I'm going to start with 2D image of the carotid artery. As you can see together, a very detailed 2D image of the carotid artery. Medial thickness. But measuring the intima medial thickness with the conventional way is not that accurate because it depends on the 2D image quality. Here in Resona 7 we have the RIA, color intima medial thickness in real time up to 6 cardiac cycles. Vector flow is a quantitative color coding vectors or arrows that display both velocity and direction of blood flow in the vessel. We have a high frame rate up to 600 frame rate per second, and it's non-angle dependent. We have a high frame rate up to 600 frame rate per second, and it's non-angle dependent. Thank you.
Welcome to Mindray. Today I'm going to show you the Mindray hepatic solution. Nowadays, liver disease is a very common and harmful disease all around the world. According to WHO data, there are at least 325 million people suffering from viral liver disease. As a non-radiation, easy-to-use medical device, ultrasound can play an important role in the diagnosis of it. When we perform ultrasound examination, usually we can divide it into two categories, the focal lesion and diffuse lesion. And today I'm going to introduce how Mindray Resona 7 responds to these two lesions and the comprehensive hepatic solution. First of all, for focal lesion such as hemangioma or liver cancer, ultrasound is mainly used to observe the space-occupying lesion for its border and internal structure. In Mindray Resona 7, with the industry-leading ZST platform, you can provide excellent image quality and powerful functions. Now, let's see a brief process of focal lesion exam. Firstly, we select the single crystal probe SC6-1U, enter the adult abdominal exam mode, and scan the patient. Due to Mindray's unique dynamic pixel focusing technology, it can achieve dynamic focusing in the whole field and obtain image with very good uniformity. When we find an interest region, we can activate the HD scope function. It may maximize the resolution in the ROI box and provide more effective information. Furthermore, if you need to observe the blood perfusion of the tumor, we can also use the contrast imaging. Mindray has UWM Plus contrast imaging technology, which is called ultra-wideband nonlinear technology. This UWM Plus uses both second harmonic and nonlinear fundamental wave to acquire the image, which can get better penetration, higher contrast tissue ratio with lower MI and longer perfusion time observation. Such as liver HCC, you can see lesion shows faster washing than surrounding tissues. UWM Plus provide high bubble sensitivity and deep penetration in the far field at 12 cm. In addition, the latest Resona 7 also provide a high frame rate contrast mode, which can reach 4 to 17 times faster than traditional CUS, which has great clinical value for vascular structure and perfusion characteristic visualization in anterior phase. Such as FNH, different to HCC. For FNH, the perfusion characteristics is like a wheel shift. Traditional contrast imaging can hardly capture the detailed perfusion in anterior phase, but high-frame CUS is able to. After finishing, you can also use the TIC curve to quantitatively analyze perfusion status. In summary, in focal lesion liver disease, Mindray can provide a complete and quantitative solution, from 2D imaging to blood flow perfusion information of angiography, which can greatly enhance the doctor's confidence in diagnosis. Secondly, let's see the diffuse lesion of liver. The fatty liver, liver fibrosis are all belong to this type of disease. We can see from the process of the disease. The healthy liver will change to fibrotic liver, then cirrhotic liver, even liver cancer. So does Dr. Han Popper said, anyone who can stop or delay liver fibrosis would be able to cure most liver diseases. So it's significantly important for liver fibrosis diagnosis. Currently, for difficult patients, the liver image is not clear enough and the internal structure is difficult to see in detail. The unique SSC function of Mindray Resona's ZST Plus platform can automatically display the 2D image through sound speed compensation to give the doctors the best display, and it extremely increased the penetration to display hepatic vein in right lobe. In addition, for the judgment of fatty liver, doctors usually scan the liver and kidney section to make a brief comparison. At this stage, doctors often judge the degree of the fatty liver through experience, and there is no quantitative tool. Mindray Resona 7's unique intelligent hepatorenal ratio function called Smart HRI. In liver and kidney section, it can do one click, automatically organ recognition and brightness information capture. It will calculate the brightness of the liver and renal cortex in B mode. This Smart HRI is a quantitative tool for fatty liver exam, delivers more reliability and accurate data than traditional qualitative estimation. As we all know, for diffuse lesion, 2D image can only show the structure and brightness information. Therefore, we need to use shear wave elastography to acquire tissue stiffness. Now, we will show Mindray's shear wave elastography. First of all, we will recommend that the patient fasting 3 to 4 hours before the examination, spine position and raise the right hand, scan through the intercostal space. The probe remains at 90 degrees to do the patient body, active the STE function, and adjust the size and position of the ROI box appropriately. Ask the patient to breathe normally and hold for a few seconds at mid-expiration. In this process, Mindray provides MSTB, which is an index that indicates stability and can provide better quality control of the operation process. From the screen, you can observe both STE and B mode image at the same time, displayed side by side. There is also the RLB function to assess whether the elastic image is reliable. The stability and reliability tools to assure better reproducibility and better inter-observer agreement of STE results. In addition, for Mindray Premium Model Resona 7, based on its excellent ZST platform, it has high frame rate STE, enables better real-time capability, which is 6 to 10 times faster than before, and can obtain smoother and continuous image to increase the doctor's confidence. After the cine is obtained, it can be measured, and circulation is recommended for the liver to obtain a quantitative stiffness value. In general, guidelines recommend get 3 results and show median value as final result. The measurement result can be viewed through the professional LSM report. Besides the simple STE process described above, Mindray also provides a variety of functions such as Fix ROI, which can fix the ROI box for real-time measurement of each frame, and by using the unique E-average to provide doctors with a comprehensive and effective tissue stiffness information. Moreover, for difficult cases, you can activate the HQ elasto mode, which can increase the penetration obviously, and it will output a signal frame of the high-quality elastography image. More detailed information, such as a complete STE CLD guideline, STQ inspection process, and case study, can be viewed on Mindray official website and webinars. In the academic field, Mindray's elastography have been conducting multi-center researches, and there are also many academic recognitions, such as from European Radiology Association and Dr. Richard Barr from United States, Dr. Ferrioli from Italy, and Dr. Zumpolis from Greece are using Mindray elastography doing lots of research and case studies. You are able to view this published paper and guidelines through Mindray. Therefore, in diffuse lesion of the liver, Mindray Ultrasound can provide the optimization of the 2D image and the quantitative automatic hepatorenal ratio, helping a lot on fatty liver exam. In addition, using Mindray shear wave elastography technology can efficiently, accurately, and quantitatively obtain liver stiffness information, which values significantly for the screening of the liver fibrosis. In summary, here is Mindray's solution for focal lesion and diffuse lesion of the liver, whether the 2D image or elastography for the stiffness information. Contrast imaging for blood flow perfusion information can provide doctors with rich tools and comprehensive solutions to help doctors diagnose liver diseases. Thank you for your attention.